A ride back in time for ambulance workers in Britain's National Health Service. While these vehicles have become obsolete, the concept behind them certainly hasn't. 65 years after its creation, the National Health Service is part of the nation's fabric. But back in 1948, with the economy struggling to recover from World War II, the idea was revolutionary.
Have you chosen your family doctor? Ask your doctor now.
For decades now, the NHS has been a model for how universal healthcare can work, funded mainly through taxes and providing treatment for everyone that's free at point of delivery. But although politicians of all persuasions praise it as a national treasure, it's at the centre of a row like never before. Campaigners say the system needs to be protected for the next generation.
Then after the introduction of the NHS, there was that security there for people, and they no longer had to worry about how they had to pay for stuff. And just my grandma's experience really has taught me what a precious thing it is and what a precious thing it is to fight for.
The current coalition government believes the survival of the NHS depends on it being reformed.
We have to ensure that the resources we put into our health service are used as wisely as possible, and as much of that money goes into frontline patient care. And part of that challenge is making sure that we deliver more care now in people's homes and in their own communities.
Others argue that changes underway mean the start of de facto privatisation and the end of the NHS in its current form. The government's plans include hospital administrations which have run up large debts, having their accident and emergency departments downgraded or completely closed. But as well as affecting places with healthy finances, like South London's Lewisham Hospital, campaigners say it's putting lives at risk.
The NHS is to be preserved. In 2010, it was deemed by proper research standards to be the most efficient in the world. And now, 3 years later, we're fighting to protect it.
For now, the NHS is still able to share its expertise with other countries. One idea being explored is training doctors in emergency medicine via e-learning.
We think that is a really powerful way, especially for developing countries, a powerful way in which to help the early stages of knowledge acquisition and training people in emergency care and emergency medicine.
But here in Britain, the debate over whether a reformed system will be recognisable as a national health service in future is still going on. Nadim, Al Jazeera, London.